Hello, have you ever been wondering what is industrial ergonomics and if you could do this as a physical therapist assistant, occupational therapist, or occupational therapist assistant? Well, the awesome answer is yes. And in this video tutorial, I am going to share with you what is industrial ergonomics, how you are perfectly positioned to get these roles, and how you can start finding these positions right now. First, my name is Dr. Emma Shapiro. I'm a physical therapist, and if you could do me a huge favor, just hit the like and subscribe button. That helps me make more videos like this to help you. Okay, so now for what is industrial ergonomics and why is that pertinent to you as a PT, PTA, OT, or COTA? So, I first have to talk about the difference between office ergonomics and industrial ergonomics. Similar to the therapy setting where we have acute care, acute rehab, outpatient, etc., in ergonomics, we have office and industrial. So, office ergonomics is going to be more where you go into a workplace like this, where you have a desk setup versus industrial ergonomics, you're going to be going into maybe manufacturing plants, pharmaceutical companies, shipping companies like Amazon, for example, and you're going to be looking at the risks and injury prevention at those sites versus more of a stationary desk site, which would be office ergonomics. So those are the two differences. Now, can you do both of those as a PT, PTA, OT, or COTA? The answer is yes. So why can you do ergonomics right now? Well, I want you to think back to all the patients you've treated. What has been the root cause of their injury? Like what causes carpal tunnel? What causes cervical radiculopathy? Isn't it often poor posture, which, if you continue to peel back those layers, is often as a result of maybe a poor chair or a poor desk setup? And so that is ergonomics. You already, for years, or if you're new grad for a couple patients, you already have been doing ergonomics, just unofficially. So you can take those unofficial skills and easily transfer them to an official role in ergonomics because you know anatomy. You are the musculoskeletal expert. And so hopefully I've convinced you that, oh, yeah, thinking about my different patients, I have done ergonomics just unofficially. And so now I'm just applying for official roles. So that is why you can do these positions. Now, would it help to have some extra education? The answer is yes. If you look on Indeed, and I'm going to show you some job postings in a minute here, but if you look on Indeed, you will see that most of them don't have any requirements. You'd be perfectly set up, and you'd actually see PT, PTA, COTA, OT on these job postings that I'm going to show you. But a little bit of extra education does two things. One, it helps you be confident in the application, in the interview process to get this job, because there are specific things you need to know about OSHA, which is sort of the main regulatory body that's involved in ergonomics. And so there's a little bit of information that would help you get the job compared to other people in the same boat. And I always want to help you get the job the fastest. And so I do recommend you take some different classes so that you understand the language and also understand the different assessments used in these different environments to safely perform ergonomics. So although you have the mindset and the skill set, there's some technical details in the assessment process and just your confidence that I think would be helpful for you to have some extra certifications underneath your name. And that also just helps in the resume process as well. So, what are these certifications? Well, we actually have two certifications. We have our remote injury prevention specialist office certification, and then we have our remote injury prevention specialist industrial certification. You can go to alternativehealthcarecareers.com and go up to courses, go to remote ergonomics, and you'll find those there. Both courses teach you how to perform ergonomics in the office and industrial setting. both in person and remotely, which I think is really cool. We like to stay up on the 21st century here, and we understand that technology is advancing so quickly, and our certifications really want to help you be able to treat both the telehealth way and the in-person way. Okay, so that's certifications. You don't necessarily need them, but I do think that they can really help you. Or if you're here and you've applied but not heard anything back, then try to get a little extra education, and that may get you into that interview process. Okay, so now let's hop into jobs here where you can see that yes, you really can do this. Okay, so I'm pulling up this job right here, and you see this is called Atlas. So, Atlas Injury Prevention Solutions is hiring. And up top, you see athletic trainer, physical therapist, or occupational therapist. But I also really want assistants to apply too. And I'll show you some assistant jobs in a minute here. But I also really want you to apply because even down below, they will mention that they also want assistants. So don't get discouraged from the main title. In ergonomics, there are so many job postings that have a lot of different titles, and they will say ATC. For an ATC watching, nothing against you, but they will say ATC. But when you look in the job posting, you'll often find COTA, OT, PT, PTA. So don't get discouraged when you look at the job postings and you see ATC. Always open it up and take that extra second. But you can see Atlas is hiring, Amazon is hiring, ATI is hiring, Briotics is hiring. There are a lot of places hiring for industrial ergonomics and office ergonomics. And you can see that the posts specifically say for you. So I really hope this has inspired you to take the leap to try to get a role in industrial ergonomics. Now, really quickly, why would you even want this role? Well, I think that there's a couple unique reasons why. One, many of us worked so hard for our degree that we really do still want to use our degree, but maybe in a different fashion. So, this allows us to still use our clinical skills, but just in a different role, a different way. Two, it pays roughly about the same, sometimes more, sometimes less, but roughly about the same as your clinical position. So, it's not going to be a pay downgrade. Three, they don't really deal with insurance. There are sometimes workers' comp cases, but otherwise, you are dealing with prevention. It's a therapist or assistant's dream. Finally, we get to prevent injury, right? And so, because you're dealing with prevention, that means no insurance. Yes, no insurance. So, you do still have to write paperwork, but it's none of that really annoying insurance stuff, which I think is one of the main reasons why I don't like therapy so much is the insurance. And then lastly, usually it is a strict 9 to 5. No more documentating till 7 o'clock at night, but not getting paid for it. Nope. You are done at that 5 o'clock or 4:30, however many hour shift. You are done, clock out, and c'est la vie. I really hope this has inspired you to take that leap. If you have any questions, put it in the comments below and check out our certifications also. Thanks so much. Bye.